Hello, ladies and gentlemen. Welcome to another episode of Health, Hygiene, and Wellness. My name is Barasa Sayenye. Thank you so much for watching Imani Television. I hope you had a lovely Easter holiday. Welcome back to our programs. I hope you get uplifted spiritually. Now, today in Health, Hygiene, and Wellness, I'm hosting Dr. Silas Wambulu, and we are going to discuss about autism. This is actually a disease that I have zero idea about, but at the end of this discussion, I hope that Daktari will give us more information. We'll get to know more about autism and how we can help the patients who are having autistic problems. Yeah, that is after the end of this program. Now, welcome to our program. We'll just begin straight away. Welcome, Daktari.
Thank you so much.
How have you been?
I'm good.
Your holiday was well?
Yeah, it was well. It was long. Thank God.
All right.
Yeah.
Welcome back. Today I would just like us to talk about autism.
Thank you.
Maybe we can begin by you giving us a brief description about autism, what is autism, and all about that.
Yeah, I think autism, we call it ASD, Autistic Spectrum Disorder. It is actually, you can call it a congenital disorder. Congenital disorder means a disease that mostly people are born with. You give birth to a child, then they have that problem already at birth. So it is a disease that is becoming very common because of the changes in our lifestyle, and it's a chromosomal disorder. It comes from what we call the X chromosome. I think you remember the things we used to learn in high school.
The genes.
The genes,
yes.
Chromosomes. It's actually genetic disorder. So there is actually maybe the X chromosome. There is a problem in terms of maybe what do you call it? The replication from the mother to the child is not good. So which means if this child is born, they don't have the same chromosomes as the one that were inherited from the parents. So that's why. But in most cases, you'd find that it's an inherited disorder, because you'd find one of the family members has autism, then you also have autism. Although there are rare cases of autism where somebody just has autism in her family and other people don't have autism. Yeah. So
it is a genetic disorder.
It is a genetic disorder.
What are these characteristics that come about when you mention autism?
Mostly autism, you know, when a child is born, I always like starting the story of autism from a child who is born at birth. The child has to cry, you know.
Yes.
These old women who have given birth to many children and they have taken care of many children, they'll always know when a child is normal or not. In fact, they're the ones who tell the parents to bring the children to hospital because they are noticing something different. So actually they have more experience than even the doctors and anybody else. So any mother who sees a child who is not okay, they'll bring the child to the hospital. But unfortunately, some parents usually wait. You know, that watchful waiting where you still feel this child will change, this child will talk, this child will walk. It's 1 year, it's 2 years, 3 years, 4 years, the child will walk. So there are those characteristics, I can say abnormal characteristics, especially if you are lucky to have had a firstborn and the child was okay, then this secondborn or thirdborn is having some new things that you didn't see in your firstborn. It's good for you to bring the child to the hospital so that we understand really, is it autism? There are very many other genetic disorders. There is even cerebral palsy, and very many, there are a million disorders.
Cerebral palsy and autism, are they in the same category?
They are, but you know, for cerebral palsy, it's not really bound to the genes as such, although it can, but it's not bound to the genes as such compared to autism. Yeah.
What are the signs and symptoms maybe that an autistic person can exhibit, especially for a child and for a mature person?
Yeah, as I was explaining, when a child is born, they have to cry. That means they are okay. They get enough oxygen. They are pink. That means you see a child most of the time when they are born, the first day they are we can say brown, let's say. You know, that pink word is not good to you. But for us, we usually look at that color to know that the child is getting enough oxygen. That's the first sign that this child is okay. when they cry at birth, this child is okay. When they start smiling, there are things we call milestones. They need to go through those normal milestones that a child can pass through. There are those reflexes that we usually check also, like the gag reflex and many other reflexes that we look at the child when the child is born. So once you realize that your child is having delayed milestones, there is a risk for autism. And autism is a disease that affects the normal behavior of the child and just interactions. You need to smile for a child, the child has to smile back to you. You need to tell a child a word, the child repeats. Like the first words that the child usually knows is mama, baba. Those words, like they hear people calling every day, and they start even calling themselves, and even just doodling and the normal things that happen in the milestones. But for the child who has autism, there is always a delayed milestone, number one. Then number two, the interactions, the behavior, the social behavior of this child is not normal. The child might get angry, the child might repeat many things, like you might just find a child the whole day speaking only one word, the whole day, they are repeating. Then there are just behavior changes, they can even harm themselves when they have grown up. And the onset of autism is funny. There is a child who can get autism at birth, but the onset of the real symptoms of autism can be at 8 years, can be at 7 years. You understand?
Yes.
So we can have even a child who can get autism even at 5 years. So a child is okay. They had normal milestones. Then all of a sudden, they just change. They don't talk. They are repeating the same words. They change behaviors. They don't want to socialize. They don't want to eat. Or if they are eating a lot. So all those changes in terms of behavior, they make this child to be autistic. And like a difference between cerebral palsy. Cerebral palsy affects motor. So like the child cannot move, they are paralyzed. But for autism, in most cases you'll find this child they are able to move. It does not affect motor.
Is it part of the brain that is affected?
It is the brain. It's the brain that is affected in terms of the cognitive function of the brain. There are things the autonomic nervous system has to put you in, like normal things like toileting and other things. So you have to look at the child's behavior to know if they are autistic or not.
So it means that it is only behavioral change that is the sign for autism.
Yeah, obvious behavior, and it's a very difficult thing for especially new parents to know, because they always feel like this child is normal. There's a child whom you realize they have changed the eating habits, then you'll just praise them that they are eating. Nowadays they are eating a lot. Little do you know that it is autism. There's a child who was not talking, then all of a sudden they have started talking a lot. You don't know if it's autism, because they feel like they are normal. But if you take them to a doctor, the doctor will assess and they'll tell you this child is not normal. So the abnormal things in that child that you notice, you just have to make sure this child has to come to the hospital so that we can assess. Yeah.
All right. Now, actually, there is a myth that maybe a person who is autistic, maybe a child or a grown-up, is somehow a genius. How true is that?
I know there are myths and misconceptions, but for the most children that we've seen with autism, at times they end up having what we call mental retardation. Mental retardation is whereby your IQ levels, intelligent quotient levels, go down. So they might have mental retardation. But there are a few cases that we've seen, they have very high IQ levels. I know there are several quotients that we look at, not only the intelligent quotients, there's even the social quotients and other things. So this child might have a very high intelligent quotient, but socially they are not good, And for you to be okay in this world, you have to have all those quotients. If your IQ is very high and you can't socialize with people, you can't succeed. You can be a genius, but you can't succeed. You can be passing all the exams, but you'll never be successful. So I don't know much about the levels of IQ in autism, but we've seen some cases where the child can do extraordinary things. So people might think they are very clever because, you know, there is always that part of the brain that has been boosted to help the other parts of the brain. They can understand many things, but in most cases in real life they'll have a problem with understanding everything, because if a child is repeating one word per day, even if you take this child to school, if you wanted them to take A to Z, they'll start with A. So if it's a normal school where the other children who are okay are there, it will affect this child, because they take long to understand from A to Z, because they will repeat A the whole day. Tomorrow they go to B, you see. So if this child is in a normal school, they won't understand, so they have to be taken to a special school. Yeah.
Now, what are the risk factors maybe that causes a child or a grown-up to exhibit these autistic signs?
Autism can be prevented at preconception, and that's why we tell most women, don't just conceive. You need, I know most of the conceptions that people have, there are at times you find they are not planned. You know, people just conceive, they didn't plan for it, then they get a baby. There is a risk for that, because, for example, take an example, a woman who is obese, there is a high risk of your child getting autism just because you are obese. A woman who is diabetic, a woman who is epileptic, let's take an example. So a woman who works in a certain factory, so you need to come to the doctor first to assess your body if it's ready for conception, because, you know, you will need to maybe to transfer all your genes to your child. If you transferred wrong genes to your child, then your child will have a problem with autism. So there are so many risk factors like obesity, diabetes, hypertension, and many other things that can come that can cause autism. Then another thing is older parents. If parents get a child when they are very old, you know, that's why we sometimes discourage people getting children when they are very old. I don't want to mention the age because somebody will tell me 35, 40, but probably starting from 42 years and above, it's not a very good age to get children, because they might give you a risk for autism, especially if both parents are above that age mark. Remember, autism, the chromosome, the X chromosome, is related to the woman mostly. So the woman has to be younger to reduce the risks for autism. Then also the other risk factor is family history. So family history is maybe if somebody has autism in your family, there is a high risk for autism also from the other children. So you need to really look at the genetic predisposition from your family members also and the members of the other family to make sure that maybe the risk for autism comes low. Just like sickle cell. We are encouraging parents to ask if you already have sickle cell in your family. We are asking parents to ask if your partner, there is also sickle cell in their family. Because definitely, you'll give birth to a child who has sickle cell. Yeah.
Dr. You know, this week the world has been marking the World Autistic Week.
Yes.
And as issues that have arisen from the week is that the government is not setting up more health facilities to cater for these autistic people.
Yeah.
How can you confirm that? What can you say about that? Do your health facilities handle these patients?
Yeah, we do have, even in our chronic disease clinic, we do have many children who have autism, and they come to us. They are handled by pediatricians. They are even older people. But the autism does not mean you will lose life, no. Your child will grow up to the required age, maybe whichever years that God gave that child in this world, as long as you take care of them. But autism, we are prepared as healthcare providers, because we have hospitals that have occupational therapists. We have physiotherapists who can take care of them. There are speech therapists, although the county governments do not employ many of them. The national governments did, but the county governments have had problems in employing them. I don't know why. Maybe they need to be advised well. But at least we have centers that are friendly to children who are autistic. Although I can say we are not very much ready, because in the terms of diagnosis, we are not teaching our people, and that's why we even come to our people here to just teach them so that they can understand what is autism. So we are not very much ready, but at least there's something we are doing.
Okay.
Yeah.
All right, Daktari, we are taking a short break here on health, hygiene and wellness. We'll be back, and I hope in the second half we'll have more to understand about autism. Don't go too far.